So we're going to talk about VHL, which is Von Hippel-Lindau syndrome, and the characteristic eye finding of the Von Hippel-Lindau is a hemangioblastoma in your eye. And the hemangioblastoma is a OMA, a real tumor of blood vessel. And so it looks like a vascular tumor. So it's the blood vessel, feeder vessel, and then there's a giant meatball and spaghetti. So this is a typical spaghetti and meatball Von Hippel hemangioblastoma. Sometimes the hemangioblastoma is inside the disc, however, and so it can be endophytic, go inside, or exophytic. So when you see reddish optic nerve tumor, that could be hemangioblastoma, or the retinal version of it, the retinal hemangioblastoma. In these patients, you're going to be looking for that exact same lesion in the head, and it can be anywhere in their brain or spinal cord, but the classic location is a cerebellar hemangioblastoma, characterized by a mural nodule with an adjacent cystic component. So you definitely have to do MRI of the head. The Von Hippel-Lindau gene, VHL gene, is a tumor suppressor gene, and so you have to look for tumors elsewhere in their body, and the ones that are dangerous are the adrenal tumor, pheochromocytoma, so they might have malignant uncontrolled hypertension in a young person, and pheochromocytoma, and the renal cell carcinoma, which means they have to have abdominal imaging. And then there's these other cysts that appear elsewhere in their body, pancreatic cysts, renal cysts, and endolymphatic sac tumors. So we have to look at the IAC on the MR of the head. All of these patients need genetic counseling, screening of their relatives because it is autosomal dominant, and that means you have to have a full pedigree. And then everybody has to undergo annual screening for the development of these other tumors. So if you see a spaghetti and meatball or a red meatball on the disc or in the disc, you should image the person, and what you're looking for is Von Hippel-Lindau.